As parents, we have all been there. Your child feels a little warm, you take their temperature, and sure enough, a low-grade fever registers. Immediately, your mind starts racing with questions about what to do next. Is this something to worry about, or can you manage it at home? Generally, a low-grade fever in children, typically considered under 100.4 degrees Fahrenheit or 38 degrees Celsius, does not automatically mean an immediate trip to the doctor. Often, it is a sign that your child's body is effectively fighting off a common infection, like a cold or a mild virus. The need for a doctor often depends more on other symptoms and your child's overall behavior than just the number on the thermometer. Your child's body is an amazing machine, and a fever is actually one of its most powerful defense mechanisms. When an infection enters the body, the immune system releases chemicals called pyrogens, which signal the brain to raise the body's core temperature. This elevated temperature helps to create an unfavorable environment for viruses and bacteria, making it harder for them to thrive and reproduce. It also enhances the activity of certain immune cells, speeding up the healing process. Deciding when to call the doctor for a low-grade fever involves looking beyond the temperature reading. Always seek medical advice if your child is under 3 months old and has any fever, even a low-grade one. For older children, be sure to contact your healthcare provider if the fever lasts for more than 24 to 48 hours, or if it is accompanied by concerning symptoms such as difficulty breathing, a stiff neck, a rash, severe headache, persistent vomiting, or signs of dehydration like reduced urination. Also, trust your parental instincts. If your child appears unusually lethargic, unresponsive, or in severe discomfort, it is always best to consult a doctor. Remember that a fever itself is not usually harmful. It is a symptom, not a disease, and it indicates the body's natural healing process is at work. Focus on keeping your child comfortable and hydrated. Offering plenty of fluids, ensuring they get adequate rest, and dressing them in light clothing can make a big difference in their comfort level. You know your child best, and observing their energy levels and how they are behaving can often tell you more than the exact temperature number. By understanding the body's response to infection and knowing which additional signs to watch for, you can feel more confident and prepared when a low-grade fever appears. This informed approach helps you provide the best care at home and ensures you know precisely when to seek professional medical guidance for your child's well-being.